With that, I'd like to introduce Bobby Scott of Ed and Workforce to give us his perspective.
Thank you. Thank you. And I'd like to again congratulate and thank our leader for her reminding people that we're willing to work to improve the Affordable Care Act, but reminding them, too, that we're not interested in helping to make things worse. Now, we have to remind ourselves, as she did, of what the situation was before the Affordable Care Act passed, when millions of people were losing their insurance every day. Those with pre-existing conditions usually could not get insurance, or if they did, they had to pay exorbitant fees. The people were hitting lifetime limits. Those families, half the families declaring bankruptcy, were in bankruptcy court because of medical bills. Thanks to the ACA, 20 million more people have insurance today. The costs are going up at the lowest rate in 50 years. Those with pre-existing conditions can easily get insurance at the standard rate. There are no lifetime limits. Bankruptcies are down 50%, on and on. But the Affordable Care Act did not cure all of the problems. It was a step in the right direction, and we need to make progress. But whatever anybody thinks of the Affordable Care Act, if you're going to make changes, you ought to improve the situation, not make them worse. And you look at all of the solutions. After 7 years of voting to repeal the Affordable Care Act, the only thing that they've come up with are things that make things worse. They're in a situation that involves arithmetic. You can't insure more people if your bill starts off with massive tax cuts and cuts in Medicaid. One of the latest proposals, repeal and replace later, you know that's not going to work, because if there had been a viable replacement, we would have seen it by now. And even if they had a credible replacement, you know they wouldn't pass the tax increases that would be needed to fund it. And so the idea that they're going to repeal now and replace later is obviously absurd. The more recent one that was introduced this morning has the same problems. You're taking money off the table and trying to cover more people. Just this simple arithmetic means you can't do that. But the incredible thing is, even with the repeal and replace later, the CBO scored that as 32 million fewer Americans would have insurance. Compared to present law, the premiums will double, and 75% of the American public would be in an area without any insurance company in the marketplace. Now, the marketplace is extremely important, because that's where you get your subsidies. That's where you are protected from price increases, and the fact that you have a marketplace with many insurers, competition puts downward pressure on prices. If you have no insurance companies in the marketplace, then obviously that's not a good thing. The incredible thing is that only a handful of senators came out against that plan. 32 million fewer insured, prices doubling, few in the marketplace, and you only had a handful of senators opposing it. Why would anybody support a plan like that? We need to first defeat all of these plans and then get together and work together on things that we know will improve the Affordable Care Act and afford insurance for many more Americans at a lower price. With that, I'd like to yield to the distinguished gentleman from Kentucky, the